once again. It's a pleasure to be back, and it's a pleasure to acknowledge that things keep moving, life keeps moving on, and we have to keep learning. So, today I'm going to talk about charting your path in pharmacy. Pharmacy is a career that I chose, pharmacy is a career that I'm passionate about, and that I love a lot. And for that, the reason as to why I'm going to talk about this is in terms of an invitation that I got last week, but one commemorating World Pharmacists Day. And World Pharmacists Day is going to be tomorrow, 25th of September. And as we are commemorating World Pharmacists Day, looking at the contributions of pharmacists across the world and pharmacy profession to the healthcare ecosystem and the healthcare value chain to a greater scale, then we need to ask ourselves, what contributions are we making? And for us to be able to make that contribution as pharmacists and the pharmacy profession by itself, then we have to chart our path as individuals within the profession. And charting that path comes from a point of understanding, where do we start the journey? How do we craft it to the end? And what is that end to a greater extent? What does that end look like? It's an important question that we need to be asking ourselves. Unfortunately, based on that invite by the Kenya Methodist University Pharmacy Student Association, I wasn't able to join them because of other work commitments and engagements. But on the same note, I did a presentation on it, and I shared it with one of my colleagues and my peers within the Agriculture Youth Voices Network, who made the presentation on my behalf. But I felt it would be of value for me to take it upon myself to do a presentation on it and discuss the key facets of what I look at, by the virtue that I've walked that journey in certain aspects, not yet to the end of it, but at least there's some insight that I feel are valuable and are critical for us in crafting our paths and charting that path to a successful career, to a fulfilling career, to an impactful life as a pharmacist and as a pharmacy profession by ourselves and in the profession. So when you talk about charting your path in pharmacy, the starting point is you choosing career, choosing the course that you're going to pursue, and that course is pharmacy. So the course selection, and you get to be admitted. So when you choose a course in pharmacy, you need to ask yourself, where do you want to pursue that course? Why do you want to pursue pharmacy? Oftentimes we are not in that position where we are informed and we are aware of the possibilities within the profession of pharmacy. And you'll see some of the times when you talk to people, the only thing they think about of pharmacy is the community pharmacy, where pharmacy levels, people are dispensing medicines and all that, and they look at it maybe as a business, which is one way. But across the value chain, from research and development in the lab to the patient bedside at the hospital setting, at the pharmacy level, whatever it is that you're doing, you're contributing to healthcare supply chain, healthcare value chain, and service delivery as a pharmaceutical practitioner. And that makes it a critical bit for you. And then based on your academic levels and your qualifications at Form 4, you'll make a choice whether you're going to do pharmacy degree level or you'll start at a diploma level, depending on the qualifications that you got. And all the key thing at that particular moment is to make a choice that I'm going to pursue pharmacy. However much I might start at a lower level, this is the commitment and the diligence that you're going to put into it that will make a difference. And ultimately, we all want to thrive. So it start at your diploma level, go to degree level, go to your master's, PhD, and be an expert in that particular line of work that you're working in and that you've chosen. And as much as you pursue the academic line, you need to look at it as pursuit for academic excellence, but also for pursuit for excellence and service in profession and in practice. And therefore, you need to ask yourself, where does the practice component interface and interlink with your training and your educational level to the practice? Very important. So the course selection and admission becomes the first criteria. And definitely, if I'm talking to most of the people who are watching this, I believe you're a pharmacist, you already have crossed that path. You're a student, you've crossed that path of being admitted into the school. And therefore, you're in the pharmacy school space. So in the pharmacy school, the key thing is you become a pharmacist by the virtue you are a member of a profession, and you've met the standards and qualifications to be conferred a degree and as a qualification to be a pharmacist, which means you passed your academic tests, academic training, you've accomplished all the requirements of that training, starting from doing your coursework, lab works, assignments, passing exams, doing your board exams, and actually getting through the process across the value chain. So if you want to chart your path in pharmacy as a career, don't take chances with the academic experience. That is learning, and passing your exams to get the degree that you deserve. That is what will make you be a competent, qualified professional by the virtue that you meet the academic requirements, including your research project that needs to be there. Ensure you give it the best you can. And when you're stuck, reach out to people, make friends, and those who have graduated before you, those who are in school with you, and your faculty. Doesn't matter wherever you're coming from. There's somebody out there who is willing and ready to walk the journey with you to help you cross the ladder and be the professional that you're hoping to be, the pharmacist that you want to be. Very important. And as much as you're learning beyond the academic experience, within the pharmacy school, there are professional associations. In this case, I mentioned that I was invited by the KeMUPSA, Kenya Methodist University, the Pharmacy Students Association. These are professional associations. One, they give you the access to networks where you're able to learn and engage with people across other faculties, across other universities, but also to know what dynamics are in the market, what is happening at the current space. You need to be able to be in tune with what are the market dynamics and what's happening out there. And I think it is a blessing, and it is actually an honor and a privilege for you to start engaging with professional associations as early as possible. You might not start at a leadership level, but wherever you are engaged, you're participating activities in events and whatever activities that are there. It opens up the pathways to you as much as it would be. And I'm glad that I saw some of the engagements over the weekend on Saturday yesterday, where most of you were part of the celebrations at Kabarak University. This is where you meet the professionals, this is where you meet your peers and colleagues, and you chart a path forward knowing that there are possibilities, and those possibilities open you up to what potential that you can harness within yourself to be the professional that you desire. That is the student association. Then at the local level, you have the national association, KEMUPSA. Please engage with KEMUPSA. When you graduate, YPG is there, and YPG is now currently actually taking even students to be associate members and to engage and work with them. And PSK, the mother association, the umbrella association, is still open and willing to engage with students. And even the World Pharmacists Day celebration yesterday in Kabarak, we had students being part of it, and PSK and YPG were leading that engagement through KEMUPSA as well. So plug in, engage, and be part of that. If you have access to these branch meetings and all that, make the best of it. HOPAC, Hospital Pharmacists Association of Kenya, get into the space. You want to learn more about the African landscape? African Pharmaceutical Network is there, and we have even student membership participation. Please sign up and let's engage and let's walk the path together from a student level and to the professional level, as it has to be and as it can be. The other key thing that is important, extracurricular activities. What other interests and what other passions do you have beyond pharmacy school? Because the reality of life is you might be in pharmacy school, but the other interests that you have that you've never realized they could be interlinked to the pharmacist world, explore them and get into that space. I have a friend and a colleague who is a pharmacist by profession, but is more into the digital health space, and therefore currently is doing digital media, Health Anchor when you look at that, Planet Wizard Media and all that. Hezron Munyakin is charting a path in the pharma journalism space. The question is, are those possibilities within your realm? You'd be a sports enthusiast. Can you look at it from sports pharmacy? How do that look like? And how can you be an expert in that space? So these possibilities are out here. Ask yourself, what interest do I have? How do I link these interests to the profession that I'm in that I also love? And then once you're able to link them, these extracurricular activities could be the pathway and the gateway to your next frontiers and possibilities that you'd have wished for. And therefore, don't let go of your passions, your interests. Just ask yourself, as much as you're pursuing them, try to build an interface where the two components can come in. Extracurricular hobbies and interest into the pharmacy world, and ensuring that you're able to drive that journey and ensure the seamless engagement and interfacing between the two. You'll be successful and you'll thrive at it. Once you're done with the pharmacy school, the next phase of your career journey starts. That is your internship after you finish stage 1 exams and all that. So the choice of internship station makes a critical difference. If you're lucky enough that you're finishing your undergraduate program and you've already made a decision on which path of pharmacy practice you want to go, that is a blessing for you. And if you've made that decision, then ask yourself, which facilities will be able to give you the best experience from the reviews that you've seen from the senior stakeholders, the professionals that you've engaged with. Ask them, where would I learn more about clinical pharmacy practice? Where would I learn more about industrial pharmacy practice? So that when you're choosing an industry to go to, you already know, I'm going to get the best learnings. And as you choose those facilities and stations based on what you've got as reviews, request that you get a contact of the senior pharmacist who might be your preceptor when you get into that station. Makes it easier to build a relationship, and therefore this person would serve as your mentor and as your personal guide in your internship journey, making the journey more seamless, more valuable, and more impactful in your career journey as you're getting into it. There are certain choices that we make choices and I'm like, I don't want to go to a busy station because it would be so busy, there's no learning for me. The busier it is, the better it is for you, because you're now putting into context, you are learning from school into real practice. So that would be a good thing for you. But also, as much as that is the case, ask yourself, how do you document the learnings from that internship experience? How do you have impact? Because at the end of the day, when you finish your internship, the only evidence of your work experience will be the internship period. How do you demonstrate that? Are you able to craft articles, write opinion pieces, concept notes, or some of the initiatives and the challenges that you noted that have different approaches and different interventions that could solve for them? These are all possibilities. Make that choice and make the best of it, and make the best of your internship from one, getting to know which station would be ideal for you based on your interest. If you don't know your interest yet and you're exploring, still make the best choice in all the 4 stations: hospital, community, industry, and primary healthcare. Make the best of them and use your preceptors to your advantage. Help you learn as much as possible. Once that is there, when you're in your station and you've made that choice, make the best by putting in the work. Work ethic, diligence, and impact of service is critical. If you're coming to a station and the only thing we know you'll always be dispensing medicine and you leave it at that, then you're not applying your scientific and pharmaceutical knowledge, and that is what we need. That is what makes you unique, and that is why you'll be a professional, because you profess a particular set of knowledge and skill sets that are unique to that particular profession. So are you doing that? So work ethic, diligence, and impact in practice would be critical, and I would urge you that when you're doing your internship, make the best of that experience. It is a learning moment, it is a learning opportunity, and it is a stepping stone into the next frontier that you're going to pursue. If you've not made a choice and you waste that internship period, you'll have to start the journey afresh, exploring possibilities and looking for options. So make the best of that journey as much as you can. Internship is paid period of your training and learning as well. So as much as it's paid, the money that you make is good. Live a decent life that you deserve, that you've worked for, but at the same time, be diligent in your use of your money. That is financial management 101. Don't spend everything. Have a saving culture and build on that saving culture. And I make it easier by saying, for you to save, you don't need to have $1 million. You need only as little as possible you can, but that commitment in you to be able to save and to be willing to save and put something aside. And in your saving plan, banks are good to have, but bank accounts don't save as much. Even in your M-Pesa, you can still save. There's a 5% savings interest that you gain from just putting in your money into the lock savings account. That is good enough for you. If you have money market options, please put up your money. At least you'll have your money security, and at the same time you have the option of having some interest that is generated and earned over a period of time. If you finish your internship, you might have your investment earning you maybe, let's say, an annual rate of a monthly rate of 5,000 or less, or about such a figure. 5,000 is sufficient for your shopping on a monthly basis. It means that interest is already catering for your shopping to lead your life as an individual, as other than drawing on your income that is already there or on your savings. So do those calculations and be clear on that. And I did a video on the financial management, especially for pharmacists. I'd urge you to look at it. It's one of the videos that are on this particular channel as you go through it. Very important for you. Then have a futuristic outlook. When you're doing your internship, ask yourself, what possibilities are here? Where would I want to get into it? You'll find you're working in a hospital pharmacy practice, and then in the process you get to find an interesting case, an interesting line of thought, and you'd want to pursue it further. Talk to seniors, talk to people, reach out and get guidance. You'll talk to your preceptor that day. The preceptor might not be the expert, but they know somebody who is an expert in that area. They will refer you. Go talk to that person. They might not give you all the information, but they are opening up possibilities for you in the sense that you're learning more, knowing more. But as much as you're learning more and knowing more, you're also building relationships and building networks. When that very person has an opportunity in that line of work, in their engagements, the first person that comes to mind is you, by the virtue that during your internship you had that interest, you reached out, you sought more information, and therefore if they need somebody who has an interest, you already meet the mark and you're able to work with, and it's easier to work with you in that level. So have a futuristic outlook, and also ask yourself, which networks are you getting into? Where are people operating from? There's this conversation that people will always ask, there are no jobs, there are no jobs. Yes, there are no jobs, that is what we agree and acknowledge. There's unemployment, but at the same time there are those who have jobs. How are they getting the jobs? Where are they getting the jobs? What are they doing that is different? I remember when I was in campus, I used to challenge myself. People used to say pharmaceutical chemistry is difficult, it's very challenging. True, it is. I'm not going to say it isn't. But as much as it is challenging, there are people who have passed. There are people who have succeeded and gotten the best grade they can get in pharmaceutical chemistry, and they're even professors in that particular line. What is different in them than I don't have? How did they walk the journey? Can you learn from them? Can you master your craft and be the best that you can be at that craft? I hope that is possible, and I believe it is possible. So let us get into it. Have a futuristic outlook. See what networks you can engage with. What can you do in those networks? Build a portfolio for yourself, and when you build that portfolio and you're able to deliver, that would be a success, and that would be a launch pad to the future of a career that is fulfilling and successful for you as you wish it for. So that is during your internship. Post internship, you're just finishing your internship. What do you do to shape your career path? Automatic posting and automatic employment is gone, and it might not come back. We hope it does, but it might not come back. If it doesn't come back, then the question is, after your internship, how do you transition? The spaces you occupy will make a difference, and the spaces will either get you the next opportunities that you're looking for that will be in line with your interests, or will get you out of touch with the realities and the dynamics of what's happening in the pharmacy world, and might end up getting you out of the pharmacy profession. So occupy spaces that expose you to the realities, that expose you to the people who can hold your hand and guide you as much as possible. And that is one of the things that we're doing within the Reculture Youth Voices Network. We engage with young healthcare professionals. We learn together. We share challenges together. We hold each other's hands. And most importantly, we execute projects and refer people to key levels and engagements where we are hoping they could find their path. And when you find your path, you'll make a difference in that line, and it also makes a difference in your own life at a professional level. And that is all we wish and aspire for. So make the best of those opportunities, occupy spaces that have value for you, that help you achieve your aspirations. Very important. After internship, another key thing that is important is the opportunities you take or the opportunities you pass over make a critical, really valid difference in terms of how your journey looks like. You'd say, I'm not going to take such a low salary because of my interest, because of my capability as a professional. Good enough. I'm not saying that you undercut yourself and take the worst salary that you can get. Get a livable salary, and at the best that you can get within the circumstances. But little something is better than nothing. If you keep drawing on your savings because you had good financial management principles initially, but now you're out in practice and you're not using that knowledge, and that you're not earning anything, therefore you're using all the money that you already saved, you are going to lose out, because your buffer is being drained. You'll get to a point where desperation is the driver in the jobs that you take, and when that becomes the norm, my friend, you are at a tough spot, and I hope you never get to that tough spot. So the opportunities you take and the opportunities you pass over will make a difference. What would be my advice? Take an opportunity that is in line with your interest. If you already have made up your mind and you know what you want to pursue long term, take opportunities in that line, give it your best as much as you can, and once you do, that opportunity and those possibilities will make you be the successful professional that you want to be, because it might start at a lower salary, but it's giving you the experience and exposing you to other opportunities. Therefore, you can grow across along that line and shape your trajectory. It's better than getting into a career path that is giving you the better income and the financing that you need in terms of the salary. It does better perks, but it's not fulfilling to you. Over time, you'll get to a point that you want to transition, and when you want to transition, you have no background experience, and therefore, maybe you took 50,000 instead of 100,000 at the initial phase, but then that 50,000 is giving you growth and long-term career trajectory. But on the other end, you took 100,000 instead of 50,000, but then the 100,000 gives you to 150, then you stall at that 150, and when you want to transition, you at that particular point, let's say for example 5, 7 or 10 years down the line, you would be making $500,000 per month, but then you're not able to make that $500,000 because you have to change and go to something that you love. Then instead of making $500,000, you're making 200,000. Is that what is the time value of that money and the differential parameters that are there? You have to be cognizant of those dynamics, and therefore my urge and my request to you is, make a choice and take up opportunities that open you up to possibilities that you aspire for. But if you've not made up your mind, take up an opportunity that you at least you feel enthusiastic about, learn from it, and figure out whether it's something that you need to venture into. The other thing, look at opportunities that offer you and grant you the transferable skills: project management, financial resource management, resource mobilization, business development. Those are transferable skills across industries, across sectors. Build on them and take opportunities that help you build on them. And as you gain those skills, my friend, you'll be set up to a successful and a thriving career. And I hope that is what you get to achieve in your journey. Finally, post your internship, you've landed your first job, and you're now in your career, in the grind, and doing everything that you can to be as successful as you want to be. Love the profession. There's nothing that you'll be able to be successful at it if you don't love it. Dedicate yourself, commit to it, and make it be what you live and breathe every single day of your life, and know that it is what makes a difference in your life. If you love the profession, if you love pharmacy, and in that particular domain where you're working, you'll be able to see possibilities, and you'll be able to see the successes that you can make in that journey. If you don't love it, chances are you'll be doing a good job at it, but you don't find the fulfillment, or you're always thinking of maybe there's something else. And if you're always second guessing and doubting yourself whether it's the right choice or not, you'll not be as successful or thriving at it. And therefore, I'd urge you to make peace and get to love pharmacy wherever you are, and make it be the career that you choose. The last thing, and that I would say on that line, stay open to possibilities, to transitions. There are changes that keep coming. Interests change, passions change, and the opportunities and possibilities come in different facets. Now we're talking about digital health. We're talking about healthcare financing. You might have started in a clinical setting, but then you realize, I've been practicing as a clinical pharmacist for a long period of time, but the challenge my patients are having is in terms of financing their care. Can I design a financing package or financing alternative solution that would meet their needs, but also deliver quality outcomes? Those are possibilities. And therefore, beyond the love, stay open to possibilities, stay open to transitions, and what I would urge of you is make the best of the profession. The profession is counting on us, the society and the world is counting on us, and as we commemorate World Pharmacists Day, we are strengthening health systems. We are strengthening health systems because we are competent, we are engaged, we are committed, we love the profession, and we are walking the journey to the ultimate end, knowing that our success is success not only for the pharmacy profession, but to the humanity and to the human race. If we make that come true, then we'll have made the success that we all wish for and hope for. Thank you so much for watching and engaging with me on this video for the day. If you love it, please subscribe to the channel, like, share your comments. Any topic that you feel we need to talk about, please send it my way, and we'll keep engaging as we move across the journey. Thank you and have a good one.